This is the model of right lower limb posterior aspect showing the right popliteal fossa. This is our popliteal fossa, a diamond shaped depression at the popliteal surface, or you can say the ventral surface of the knee joint. This is the boundary of the popliteal fossa made by this blue card. Now, the popliteal fossa, as I've said earlier, is a diamond shaped fossa. Its boundary is formed. It has got four boundary: superomedial, as this is the right lower limb, so this is the medial and this is lateral. This is the superomedial border, superolateral, inferolateral and inferomedial, the four border. Superomedial border is formed by semimembranosus muscle, this one semimembranosus, and this one semitendinosus muscle. These two muscles arises from the ischial tuberosity, and semimembranosus is inserted on the posterior surface of the medial condyle of tibia. Okay, there is a depression over there, over which it inserted, along with it also gives the oblique popliteal ligament. It also intermingle with the deep fossa of the leg, as well as it has got four insertion in the medial border of the tibia also. Okay, and so semimembranosus and semitendinosus, it also arises from the ischial tuberosity and going to the medial surface of the tibia and being the part of the or constituent of the pes anserinus. Pes anserinus is the insertion site, a common insertion site of semitendinosus, gracilis and the sartorius on the medial surface, upper part of the medial surface of the tibia. So, superomedial boundary is formed by the semimembranosus and the semitendinosus muscle. Okay. Now, superolateral boundary is formed by the long head and the short head of the biceps femoris. Long head, we all know, also arises from the ischial tuberosity, and short head from the lateral lip of the linea aspera and going to the insert on the head of the fibula. Okay, so these two muscles form the superolateral boundary. Now come to the inferomedial boundary. Inferomedial boundary is formed by the medial head of the gastrocnemius muscle. Okay, and the inferolateral boundary is formed by the two muscles, that is the lateral head of gastrocnemius in white color, and this blue one is the plantaris. Lateral head of gastrocnemius, it arises from the lateral aspect of the lateral condyle of femur, and medial head of gastrocnemius arises from the posterior surface. Lower posterior surface is also known as the popliteal surface. Popliteal surface of the tibia, popliteal surface of the femur. Okay, and this one arises from the lateral aspect of the lateral condyle of the femur. Okay, now these two unite further. Now we should focus on only the popliteal fossa. So, and the plantaris muscle also arises from the lateral supracondylar ridge, and all these three muscles, that is the medial head of gastrocnemius, lateral head, as well as the plantaris and also the soleus, they all by the tendoachilles insert on the posterior surface of the calcaneum. So these are the boundaries, and the roof is formed by the skin. superficial fossa and the deep fossa. In the superficial fossa, there is many cutaneous nerve. This one is the posterior cutaneous nerve of thigh. On the posterior aspect of the thigh, this is the posterior cutaneous nerve of thigh, direct branch from the sacral plexus. So this lies in the superficial fossa of the popliteal fossa region. Okay. And what else? This one is the posterior division of the medial cutaneous nerve of thigh. The anterior division of the femoral nerve give two cutaneous branch and one muscular branch. Two cutaneous branch is the intermediate cutaneous nerve of thigh and the medial cutaneous nerve of thigh. And the muscular branch is going to the sartorius muscle. That medial cutaneous nerve of thigh again gives anterior and posterior division, and this one is the posterior division of medial cutaneous nerve of thigh. Okay. And now what else? This is our saphenous vein. This one is saphenous vein. Saphenous vein starts its journey from the medial side of the dorsal venous arch. So this one is saphenous vein. Okay, this one is saphenous vein coming from the medial side, and it drains into the popliteal vein. So it lies superficially. It opens into the popliteal vein, but it lies then superficially into the superficial fossa of the popliteal fossa region. Okay, saphenous vein. Saphenous vein, small saphenous vein, and this one is the cutaneous branch from the common peroneal nerve. This one is the common peroneal nerve. This is sciatic nerve divided into the common peroneal nerve and the tibial nerve. In white, in this one is yellow one is a tibial nerve and green one is the common peroneal nerve. Common peroneal nerve gives one cutaneous branch. This is the lateral cutaneous sural nerve. Okay, lateral cutaneous sural nerve. And this one is the medial cutaneous sural nerve. This one, medial cutaneous sural nerve coming from medial side, the branch of the tibial nerve. All this lies in the superficial fossa. So skin, superficial fossa, and then deep fossa. Superficial fossa containing posterior cutaneous nerve of thigh, posterior division of the medial cutaneous nerve of thigh, a branch from the common peroneal nerve, that is the lateral sural cutaneous nerve, and this one is the medial sural cutaneous nerve, a branch of the tibial nerve. Okay, now deep fossa. This makes the roof of the popliteal fossa. Now what makes the floor of the popliteal fossa? This is the popliteal surface of the femur. Popliteal fossa is behind the knee joint. The knee joint is formed by the femur above and the tibia below. So this is our popliteal surface of the femur. Then comes capsule of the knee joint. Here lies capsule of the knee joint. Here, capsule of the knee joint. And then also this is oblique popliteal ligament. And then comes this in black color, this is the popliteal muscle. So popliteus muscle, it also makes the floor of the popliteal fossa and is a thick fossa over covering the popliteal fossa, popliteus muscle, a thick fossa. That fossa also makes the floor of the popliteal fossa. Okay, and what are the content? Content is the common peroneal nerve, tibial nerve, popliteal artery, continuation of the femoral artery after the adductor hiatus, popliteal artery, and this is the our popliteal vein. After the femoral vein, continuation of femoral vein after the adductor hiatus, popliteal vein. Okay, and the termination of the small saphenous vein. Okay, these are the nerve, vein, artery, and also lymph node are there, and the fat. These are the content of the popliteal fossa. Regarding its clinical significance, there is two main clinical significance. First is Baker's cyst. Very common in clinical practice. Baker's cyst is very common, and what it is in the semi-membranosus, what we are seeing here. There is a bursa. Yeah, this black one. There is a bursa. This is semi-membranosus bursa. And this also, the semi-membranosus bursa, in between the semi-membranosus and the medial head of gastrocnemius muscle. The bursa lies to combat the friction, in between these two muscles, and also in between the posterior surface of the femur and the semi-membranosus muscle. This one, there's also bursa. Both are known as semi-membranosus bursa. And inflammation of this bursa is called the Baker's cyst. It is also known as popliteal cyst. So patient will come with the pain and swelling of the popliteal region, and it is also painful. It subsides spontaneously with the anti-inflammatory drugs. Okay, and what others? The popliteal aneurysm, the dilatation of the popliteal artery at the region of the popliteal fossa is called the popliteal aneurysm. And the main sign and symptom of popliteal aneurysm is due to the compression of popliteal artery due to the dilatation over the tibial nerve. Tibial nerve get compressed by the dilated popliteal artery, which is more than 50% of its diameter. The tibial nerve get compressed and will result as it is supplying the posterior compartment leg, and posterior compartment leg are the plantar flexor. So there will be loss or weakness of the plantar flexion. Okay, and also there is sensory loss in the posterolateral aspect of the leg as well as in the foot. So this is all about the popliteal fossa. Thank you.